Everybody here with Josh and Paul per usual, and Melissa McCaw is here, runs OPM, Office of Policy and Management. I'll be here talking a little bit about our public health, and she'll be here to talk about our fiscal health, and the two are related. First off, let me show you our COVID daily summary. A couple of things worth noting. We've now surpassed 4,000 folks who have died due to COVID. I remember a few months ago when the Surgeon General came to our state and thought it might be like a bad flu season, which is, say, 150 fatalities. The good news, I guess, if there is anything, is good news. Again, our positivity rate is low. That's 148 tested positive over 5,000 tests. That's less than 3%. It's been less than 3% now for, it's really less than 5% for, I think, a week. So I think you see that we're making progress there. I do worry a little bit that people get casual now. We're having to urge people to get tested. Testing is down a little bit, as you see, and how important that is. And I don't want us to get in casual in general. I see the flare-up in Charlotte. I see the flare-ups in Phoenix, Arizona. I see what's going on around the country, along with South Korea. Israel just had to close down their schools, which is why we are being so careful as we reopen. And we did our announcement yesterday regarding graduations, and we'll be making further announcements tomorrow. Total hospitalizations statewide, I think you still see the trend way down 75%. Anything else there, Max? I guess not. Let me just say something before we go into our fiscal health. And that's, this is all about trust. I mean, you've got to take the words of our experts and others when we give you the best guidance we can in terms of how to keep the public health and making sure we don't have a flare-up going forward. That's tied directly to what Melissa and our business folks are trying to do. Nobody's going to go back to work. Nobody's going to be buying things unless they have trust and confidence that the advice we're giving them is well taken. It's safe to go back, provided you follow the precautions. And as you've seen from another night of protests around the state and around the country, that involves trust as well. Trust that this is a society that, despite some gross injustices, is trying every day to do a little bit better. And as you've heard, because we've had some of our folks from public safety here, I've been proud of the efforts our public safety has made working closely with the protesters. And what that means in terms of trust, because if you don't believe that public safety is there for you, and if the protesters don't believe that there's sometimes a shared goal out there, you have some conflicts and dangers, as you've seen all around us, and thank God not yet here in Connecticut. A part of that trust is, part of that trust is transparency and accountability. And there I'd like to say that Connecticut is got a long way to go, but we're off to a good start. You maybe remember last year we passed a bill with great help from Senator Gary Winfield, New Haven, and Representative Steve Stastrom. That bill sailed through at a bipartisan basis. The state Senate got clicked up a little bit with partisanship in the House, but it was a really important bill. There's a lot of questions and talk out there about use of force. And how is it excessive? And what are the rules of the road? And how can our public safety officials be better? And this bill clearly defined what those rules of the road can be and tried to narrowly define the use of force in a way that I hope makes our folks safer. It mandates that we categorize the use of force and make sure that we are able to report on that, strictly in terms of chokeholds and other things that we now find reprehensible. It clearly defined that going forward. You know, you'll find that a lot of people are talking about other ways we regulate the use of force. There's been a lot of talk about when you use a firearm, when you can shoot a firearm, for example, at a fleeing car, This bill addressed that, put in place, again, some confidence-building measures that we're listening to you, doing what we can, made requirement there for our body cams. Those are the things that our police have. It goes on automatically when the lights go on in the police car. That those ought to be released. Within, I think it was 4 days was the requirement coming out of the bill that our legislature wisely passed. 4 days, why is that? To give you confidence that we have nothing to hide, give you confidence that our public safety officials want to share with you their best efforts. I've gotten to be pretty good friends with our detail in the state police, and I said, you find this intrusive? Do you find this the heavy hand with the mandating the body cams? And they said, not at all. We think we've been doing the right thing, and now I want a body cam that shows that we were doing the right thing. The exact opposite happened in Minnesota. I just also say included in that bill that passed last year was a public police accountability and transparency task force. They met a few times, got COVID interrupted, and together with the legislature, we're going to work to make sure this gets rejuvenated now. It includes the district attorney, it includes commissioner of public safety, it includes state police, and it includes community activists. And next meeting is scheduled for early next week. I hope they invite me to attend, at least electronically. I'd like to be there. I know the Attorney General, William Tong, would like to participate as well, just to make sure we know this is just the first step as we listen and try and do a better job of building trust between our public safety and, in this case, the protesters, more broadly, the community and public that they represent. I'll just leave you with the thought that we're one of 12 states in the country where police disciplinary records are generally accessible. We were the first state to collect traffic stop data. That was back in 2013, way before my time. Now it's a model for California, Oregon, Rhode Island, and other places. It was that same year that we made it illegal for our police departments to hire officers who were, quote, dismissed for serious misconduct or resigned while under investigation. It looks self-explanatory today, but we were there. We're just getting started, trying to earn your trust when it comes to public safety, because that's how we all stay safer. And with that, let me just say, Melissa McCaw has been doing yeoman's work when it comes to our fiscal health. And as I said before, our fiscal health and the numbers she'll talk through are really key to trust again, because if people don't feel safe going back into a business, if employees don't feel safe that they can go back to the business, if they don't know we have a 211 hotline, so if you find something is awry, give us a call. We're going to do everything we can to keep you safe. Then the consumer, then the customer, then the employee is going to be reluctant to get back to work. And for our fiscal health here as a state, it's very important that we can see our economy slowly getting back to work. Melissa will describe, the numbers as we look at sales tax and income tax, and we count on it ramping back up by the end of this calendar year. You've heard big numbers coming out of Washington, D.C., the Paycheck Protection Program. That was $6.8 billion to the state of Connecticut alone. That provides money for small business to bridge their need until we can get this economy going again. It runs out end of June, end of July, depending on when you got that loan. That's why getting the confidence to rebuild our economy is so important. Unemployment compensation, we've put to work, I think it's, billions of dollars right now, a couple $2 billion out there. The true-up goes till July 31st, so that does not go forever. Now's the time for us to be thinking about how we get back to work. But what Melissa would like to talk to you about is the COVID relief money we got as the state of Connecticut. It's about $1.4 billion. It goes to pay for a lot of COVID-related expenses. It doesn't help us with the fact that our income tax and sales tax took a big hit over the last 3 months, and it's estimated to take a hit over the next 6 months. But it helps in terms of those COVID expenses. And Melissa's going to outline what it means for different constituencies, stakeholders here for the state, and in particular for our municipalities. Melissa?
Great. Thank you very much, Governor Lamont, and thank you for teeing that up. Today I will just remind us about the state's fiscal health, and Connecticut's position at the current time is very strong. We entered this particular unprecedented public health emergency from a position of strength with a greater than $2.5 billion rainy day fund, one of the highest in the nation and the largest that Connecticut has ever had. So from a cash position, and what does that mean? Making sure you have money in the bank to pay the bills, we're in a strong position. We will close the current fiscal year with a $600 million shortfall, and we will have to tap our rainy day fund. And as we go into next year, we do face a $2.4 billion deficit on a $20 billion budget. And we will have to use multiple tools between our rainy day fund and some cutting back, if you will. But we will survive that, and our focus today and the focus of the governor is ensuring that Connecticut is able to emerge from this public health crisis and begin to reopen our economy in a safe way that creates confidence. And that will ultimately have an effect on the state's finances as people are reemployed, businesses begin to rebound. We'll see the benefit of that in our tax revenue. But today I really want to focus in on the extensive financial support that we have received from the federal government that, quite frankly, if we did not have, would have made it very difficult for Connecticut in responding to the public health emergency. So as noted, the $1.4 billion is just one of the resources that has been received from the federal government to help Connecticut cover the cost that we are experiencing related to the pandemic. And so these funds are subsidized along with other programs. We have the FEMA program that provides support. But we really wanted to focus today on our municipalities. Our municipalities, your town, my town, is also feeling the impact of additional coronavirus expenses, whether it's to stand up additional food programs for seniors or to sanitize buildings or additional overtime that they might be experiencing in the public health department or their public safety department. And so the governor was very focused on ensuring that we are able to provide financial support. And today we are announcing a $75 million municipal coronavirus relief fund. Beginning in April, we reached out to all of our municipalities to inquire about estimated costs through June 30th, 2020. And we completed that process on May 29th. Our towns and cities told us that through the end of the current fiscal year, through June 30th, that they estimate that they will incur $40 million of direct costs. And so we are standing up $75 million in support. We have recently learned that the federal government will allow us to match the FEMA reimbursement with coronavirus relief funds. So FEMA cost, whether it's shelter-related expenses, PPE-related costs, other supplies, the federal government will reimburse at 75%. This new program that the governor has authorized, the Municipal Coronavirus Relief Fund, will be able to match those dollars at 25%. And so between the FEMA, along with the Coronavirus Relief Fund, and any other federal funding dollars, we believe that municipalities will be fully funded for their expenses through June 30th, and we will then begin to evaluate the program for expenses beyond that time period. Just to be very clear, to use these funds, they have to be direct COVID-related expenses. They do not cover any lost government revenue, cannot be for funds that you previously had budgeted, and the bottom line is it has to be for expenses during the public health emergency between March 1st and December 30th. You should know that there are a number of funding sources to support towns. So in addition to the program the governor's rolling out and FEMA, $111 million was released to all of our boards of ed through Commissioner Cardona's office, the State Department of Education, to support remote learning costs for all of our children in pre-K through 12. So those additional expenses that your schools incurred to ensure that our children were learning from home. So that will help to support what expenses have been incurred, and also as we begin to think about what the fall might look like, so along with public health costs for your local health districts and other grants. So one of the conditions of participating in this program is that municipalities would first use other federal funding sources first, and then they would seek reimbursement through the governor's grant program. Other things that I would highlight is that towns will be required to submit for reimbursement or an approval of what could be reimbursed through FEMA first, and then anything that is remaining that is eligible through the Coronavirus Relief Fund can be reimbursed from the $40 million that the governor is making available. In order to do this process, I thought it was very important that towns have an electronic process to submit their claims, and so we have created a portal, and so municipalities will have an opportunity to participate in webinars and go through the process of how they would actually submit for reimbursement. Some examples of the types of expenses that towns are incurring: cleaning costs, disinfecting public buildings. Perhaps towns have had to incur additional IT-related expenses for teleworking, school distance learning, additional overtime costs, shelter costs for our vulnerable population that might have needed some housing, and in many cases we had to take them out of congregate settings and put them into smaller settings to prevent the spread of the virus. And so $75 million is being provided to municipalities out of the $1.4 billion. We do believe that the $75 million coupled with FEMA reimbursement, which could leverage another $100 to $200 million for municipalities, will allow us to support all of our cities and towns through the majority of the rest of this calendar year. And so I know there have been a lot of questions about how the state will utilize the $1.4 billion that has been provided. And so we want to make sure that we're providing transparency. So I want to highlight some of the other decisions that the governor and the administration have made with respect to the COVID response. And so in addition to the $75 million for municipalities, we have provided a reserve funding of approximately $125 million for our nursing homes. Our nursing homes are experiencing increased costs to support workers, whether they have to incentivize or cover additional overtime, additional PPE, other supplies, and therefore we've put in place a financial package to support nursing homes. We also are reserving $250 million for testing. This is a critical component of the state's COVID response, and also building confidence that we can return to some level of the new norm. And so you will recall this week that nursing home staff and residents, as well as assisted living staff and residents, are now required to have testing at specific frequency intervals. We have set aside funding to help support some of those costs, and COO Josh Jabal is on the line, and the team is continuing to build out what that testing plan will look like. And so that is evolving. The state has reserved $100 million for PPE, which will also be matched by FEMA. Within our state agencies, we've incurred a significant amount of expenses. Approximately $65 million is estimated to cover the sanitation of our buildings, to stand up the mobile hospital that we needed to have in place in the event of a significant surge. To cover overtime costs for the staff that provide direct care. And so $65 million has been reserved for those types of expenses. Even our institutions of higher education, they've incurred similar costs, and we're providing support of $25 million to offset the expenses that they've experienced. And finally, you heard the governor talk a little bit about the housing support program. We are reserving $10 million for housing supports for rental relief. You are aware that through executive order that individuals have some protection for a short time frame from eviction, but we all understand if you're not receiving your standard paycheck and you're receiving less than, or you're have some financial challenges, that when that period expires, individuals could be facing eviction. So the governor's felt it's very important to provide some supports to help individuals through that time period. So I say that to, one, make sure that you're aware that your state is ensuring that COVID-related expenses that are critical to our response and to ensuring that we can reopen safely, that those commitments are being made to date of about $650 million. And as we continue to work on reopening and understand the best practices We will continue to roll out additional funding, many of items of which are under consideration at this time, and we'll continue to update you accordingly. So that's a summary for today, and we will be communicating on our website with municipalities as well as directly how they can access the support program to help your towns with the additional costs that you've incurred.
Well, you just did this for the Democratic leadership. You just did this for the Republican leadership. You've got the presentation down. Thanks, Melissa. Any questions?
Channel 3 Eyewitness News.
Yes, Governor, in light of what we know about schools reopening, we just got this information from the teachers union where 43% say that they're at high risk and 64% say that their schools are really not equipped for sanitary measures. How is that going to have an impact on successfully reopening schools for the fall?
I mentioned trust at the top of this, and we're working very closely. Jan Hockadell, as you know, was on our reopening committee, working closely with Jeff and Don and everybody else representing the teachers, making sure they are part of the process as we slowly plan on our reopening of our schools this fall. We also have to talk to parents and give them confidence that we're doing this in an appropriate way. There'll be social distancing, there'll be spacing between desks, there'll be sanitation standards, there'll be masks. That's all from a public health protocol and also a confidence builder.
But I mean, if the teachers really, or nearly half of them, don't really feel comfortable coming back, I mean, what type of impact could that have on the school year?
It doesn't sound that good to me, so that's why we continue to give people the best sense I can, working with the very best healthcare professionals, that we can open the schools and open them on a way that keeps you safe and your kids safe.
NBC Connecticut.
Hi, Governor. Quick question for you about the Restaurant Association. More than 550 restaurants signed on to a letter to you asking you to consider opening indoor dining on Wednesday, June 10th. Is that something that you would reconsider, and what's your response to them?
No, not June 10th. I've just seen tens of thousands of people are protesting in New York City, thousands more in Boston. Neither of them have opened up any of their restaurants. They haven't even opened for outdoor dining that I know of as yet. So I want to be very careful before we open our restaurants, invite people from the whole region here. But I think we'll be getting there, as part of our phase 2 plan.
And when do you expect to release more details and guidelines about what it will look like for gyms when they reopen on June 20th? Do you expect that people working out will be having to wear masks while they exercise?
Yeah, I think we are planning to release all those protocols, including gyms and indoor dining and all those specifics on Monday.
Perfect. Thank you, Governor.
Move along next to News 8.
Good afternoon, everyone. Governor, I hope I'm not jumping the gun on this, but I did have a question regarding the mortgage relief program, if that's okay. With respect to, obviously there's so much good that has come out of that, and really the announcement about the extension certainly buys people a lot of time. Nothing is forever, though. Have some of the participating banks and so forth expressed to you that, there is a point where we're not going to be able to do an extension? In other words, if need be, will you be able to go beyond July 30th?
I hope not. I mean, I hope the economy's getting going and people are slowly getting back to work. As you heard, the PPP, a lot of the other protections that have been put into place run up until June 30th or July 31st. The $600 true-up on unemployment ends then. And I don't have any idea what the federal government is going to be doing for the next round. So that's why I want to cautiously but thoroughly get our economy moving again.
Fox 61.
Good afternoon. Governor, just yesterday you had announced that schools will be able to hold graduations in July with up to 150 people, and there were a lot of happy students. We've been receiving emails from charities looking to see when they'll be able to hold fundraisers and brides and grooms wondering when a decision will be made so that they can figure out whether or not to even hold a wedding in the summer months. So why do charities and weddings need to hold off when these graduations can be held, and what guidance are you giving to those groups?
We'll be giving formal guidance again. I think it's tomorrow or Monday, very soon. Look, a graduation seemed to us, it's invitation only. You can easily socially distance. I know how important it is from a ceremonial point of view to bring the completion there. It's not a social occasion. There's not a drinking and in that sense. So I thought it was a different type of event that allowed us to give some clarity for people so they could plan in and around what they wanted to do this June in terms of drive-through and Zoom and smaller, and then a little bigger come July 6th. Josh, anything you want to add to that discussion?
No, that's great. I mean, we've already signaled, moving to a 50-person limit for weddings and, other outdoor social events targeting for June 20th, and then potentially increasing that further a month later, again, if the metrics continue to move in the right direction.
And another question, it's either for the governor or the secretary as well. We've heard about all of these different steps being taken to help people during what have been very difficult times economically and financially for them. Is there anything that's going for people?
You mind?
Amanda, can you repeat your question, please, for the governor? We had a technical difficulty.
Sure.
If you could repeat your question.
Oh, I'm sorry. I wanted to see if there was going to be any extension on taxes and other payments for municipalities, any guidance from the state on that to help people out during these difficult times.
You want to speak to that?
Sure. Thank you for the question. As you're probably aware, Connecticut and many other states have already done a significant amount of approval in terms of deferring taxes. And so most of our taxes that we would have received between March and June 30th technically have been deferred. So personal income tax, sales tax, business taxes, and we did that obviously in respect and recognition for the challenges that individuals and businesses were under, and that was absolutely necessary for the emergency that we were within. But at this point in time, in light of the fact that we are moving towards reopening and the significant resources the feds have stood up in the PPP program, we believe that the deferrals that have been provided to date have been adequate, and we have to begin to resume the standard payment schedule. Obviously, in many cases, when individuals are not working or businesses have a lower amount of income, then they're paying a lower amount of taxes. But at this point, we are moving towards a safe and hopefully successful reopening, and therefore we're moving back towards our traditional tax payment timelines.
Thank you.
News 12 Connecticut. WTIC 1080 News.
Hi, Governor. CCSU students held a pretty loud rally around 1 o'clock right outside there. Did you hear it, and do you think the message is getting through?
What was the rally? I guess I didn't hear it.
It's a couple thousand, well, no, it's about 1,000 CCSU students outside Black Lives Matter. They're very intense, and I was just wondering if you think that we've done this before with the protests, so, since the 60s and more. Do you think maybe it'll get through this time?
I confess I did not hear that particular rally. I feel a little guilty because I did teach at CCSU for about 12 years, so I would have gone out. Look, I love the fact that young people are standing up and for a principle bigger than themselves, and do that safely. I'm there and I'm ready to listen and to see what we can do better together.
Now, after that, I took a walk through Hartford and was just thinking how quiet it is, even at lunchtime. I know someone earlier asked about moving the opening date back from the 20th to the 10th. Does it hit you at all that, are you itching at all to open? Because it is drastically quiet in any of the cities around the state.
Oh, you bet. I'm itching to get back. I was eating outdoors that first weekend. I loved it, and I understand everybody is feeling equally itchy to get going. I also know that I'm looking around what's going on in the rest of the country. I see some of these flare-ups, and I've got to remind people we still have a COVID crisis to work through, and we're working it through.
Thanks.
The Associated Press.
Good afternoon, everyone. Governor, I guess in late May, the Yale School of Public Health released a report that warned that if interactions between people return to the levels that they were in early March, that the number of new cases of COVID could rise dramatically over the summer. I was wondering, what does your modeling see? And we're at over 4,000 deaths now. What can we expect by this fall?
Well, let me start for the next 2 weeks. I mean, obviously, where we are right now, big protests, you see people close in. Obviously, casinos been open up for about a week. So I think the next 2 weeks will be somewhat telling in terms of were we able to tamp things down? Can we keep this 2 or 3% positivity rate under control? Or will we see some potential flare-ups? I think you remember from Drs. Gottlieb and Emanuel that they thought, look, provided social distancing, we feel like we could predict our way through August and September, provided we, control those other extraneous things. They were worried more about November. They talked about a flu season. They talked about making sure you're immunized for the traditional flu so we don't confuse that with COVID if we see a potential flare-up there. That's a time frame that I'm focused on as well.
But do you have any modeling that shows potentially what the numbers could be in the next couple of weeks or this coming fall?
Want to speak to that, Josh?
Yeah, sure. So thanks, Sue. So we're in constant contact with a lot of the folks who are doing the modeling exercises, including that team at Yale, Forrest Crawford, who published that study. I think the key thing to point out, though, is that scenario in his model that you're referring to, like you said, assumes we go back to the way we were, early March before this all happened. And as the governor has laid out very clearly in the reopening criteria and all the guidelines associated with all the businesses that are being reopened and other activities that are continuing to be delayed, we're not going back to that time, anytime soon. We're all going to be wearing face coverings and close contact, taking measures to ensure public health, for the foreseeable future. And so, we don't see any of those extreme scenarios as likely, but that's, again, dependent on all of us doing our part to wear the mask, to wash hands, keep our social distance, to obey the rules.
Thank you.
The Connecticut Mirror.
Good afternoon, everyone. I had two questions, please, for Secretary McCaw. I wanted to ask you, when you outlined the roughly $650 million in commitments of CARES funds so far, out of the $1.4 billion, does that mean that most or all of these groups will get a second bite at the apple if they, as they continue potentially to still incur pandemic-related costs in the second half of the year?
Thank you for the question, Keith, and good to hear you today. So obviously, here we are, it's June 1st, and the funding the feds have provided is supposed to get us through another 6 to 7 month period. And so for those reasons, we have to be very cautious with how fast we commit these dollars. As CEO Josh Jabal and the team are still finalizing our testing strategy, the needs of municipalities could slightly change. Nursing homes is a great area of focus, and some of these items reflect commitments through a fixed period of time. If there's a need to extend, the state needs to have some flexibility. But on top of that, there are a number of other stakeholders that are indicating that they are feeling challenged financially because of the COVID-related impacts. Quite frankly, the request for COVID support well exceed $1.4 billion. And so there are other areas where we are considering support, and at the same time, we need to leave ourselves with some flexibility in the event that some of the areas that are critical to our strategy to mitigating growth and resurgence, in the event that we need to invest more resources. So we're being very cautious, obviously knowing that the general fund is not really an area where we can withstand these fiscal pressures. So we are obviously have other items that we are working on behind the scenes and leaving ourselves with some flexibility for surprises.
Hey, Keith, I'd only add, I'd add that the other great wild card out there, Keith, is the federal government. We don't have any idea what they're going to do on another supplemental. You see in our list there, $250 million for testing. They've recommended we test a lot. And they can't make up their mind whether FEMA will pay for 3/4 of that or not. So Melissa's got to be very cautious, because the federal government can just borrow their way to prosperity. We've got to keep ourselves, on a leash where we can balance this budget and make sure we get the testing done. Those are some of the variables we got to think about.
That's right. And you think about our nonprofits that are on the direct front lines that are still looking for support. You have some of our smaller hospitals that are struggling and didn't have the capacity. So there really are a number of other key stakeholders that have not yet been addressed. And so very easily the remainder could be exhausted as we think about those other populations. But by and large, these are the areas we've focused on immediately because they're critical to our very early response.
Just one quick follow, because you outlined a lot of areas and you threw out a couple more that could potentially get funding. But on the other hand, you've committed $650 out of $1.4 billion. So are there any other groups besides nonprofits and smaller hospitals that might have a claim to the remainder of the money? And I know you haven't officially closed the door on anyone else coming back either. Are there any other groups potentially in play for this money you can talk about?
There are, Keith. I'm going to reserve and not discuss that, but I just think about some of the questions that have come up around education. And as Commissioner Cardona is awaiting the plans from districts on how they will utilize the $111 million, the superintendents are also responding to what does our education system look like come fall. And so if there are additional costs, that's an area where I could see there being investment. Workforce development is another area that certainly could be very useful in light of the unemployment that we're experiencing. So higher ed, our Yukon Health Center is struggling, and I mentioned nonprofits. So there's a very broad list, and we're going to continue to prioritize and do our best to be respectful of where individuals and organizations have had significant negative impact.
Thank you.
The Hartford Courant.
Governor, a few legislators today, along with some frontline workers, held a press conference where they asked you to secure for them more protections, including firmer workers' comp regulations and also more PPE, things like that. Are you working on anything to help out frontline workers beyond what you've done so far?
Every day. First of all, on PPE, I think we have secured PPE, so there's absolutely no excuse for any nursing home, senior care facility, not to be able to provide every single worker exactly what they need. There was no excuse before, by the way, either. We had them just in time. I want to make sure that's clear. And yep, we're having conversations about workman's comp and all the other COVID-related issues that are out there.
So to be clear, it wasn't just nursing home workers, but service workers who feel like they could be at risk and don't have adequate PPE. Is there any sign that there could be PPE beyond just health workers, hospital workers, and nursing home workers?
Look, we can provide some of the PPE on an emergency basis, but look, frankly, Stop and Shop ought to be responsible for their own employees, and we've mandated you've got to have a mask available for each and every one of them. We can provide each and everything for the private sector, but that's their job is to step up and provide this important PPE for people. It is available. It's commercially available. Josh has put it, or I think David's put it on the DECD website. We got wholesale pricing. We got good places you can get it. Go get it.
And then the other thing I wanted to ask was, we're now more than 2 weeks out from the initial reopening, and the numbers have continued to trend in the right direction. do you guys kind of feel good that the initial reopening did not cause a spike, or is it too early to say that?
I think the initial reopening has gone very well, and it has not caused a spike. You know, my worries, in particular now with these big demonstrations and people, you know, not necessarily 6 feet apart, not always wearing a mask. Those are going to be the flare-ups we have. I think Josh has been very disciplined in terms of the nursing homes, correctional facilities, testing out there, testing on a regular basis, inspecting on a regular basis. And in particular, also those neighborhoods where people live very close together, right here in the city, right here in North Hartford, making sure that we can encourage people to get tested because that's the safest thing for the community.
Thank you.
Hearst, Connecticut Media.
Hey, Governor, I don't think you would have been too happy seeing those 400 CCSU students standing 2 feet from each other, masked on the north steps today. But having said that, maybe this question is for Josh about how is it on the front end with the hospitalizations in relation to the last, considering that the incubation period is 8 to 14 days, we're 15 days into the start. Are the initial hospitalizations holding or decreasing, or do you know?
Yeah, no, they're holding very stable at very low levels, and you can see that in the net, total hospitalizations data we report every day, which is now down below 400, lowest level it's been since we were ramping up in kind of mid-March. But you're
March 29th.
You're right, Ken, in the time dynamic here, and in part to answer Alex's prior question, picking up on where the governor commented that that incubation period, and then from the time that the person could become contagious, go get tested, get the test results, potentially present at a hospital. That's why the public health team recommended this kind of 4-week phasing between phase 1 and phase 2 to make sure you have adequate time to see that progression if there is in fact an uptick. But so far, as the governor said, the results are very encouraging.
Thanks, Josh. Governor, can we talk about diversity a little bit? What kind of thoughts are going through your head now that you've got a Supreme Court justice opening?
What I'm thinking about is we're going to release the names of folks for Supreme Court, Appellate Court, I think in the next 3 weeks or so. And I think you've heard me say before, Ken, that I want to make sure that we have a government that reflects the diversity of our amazing state. And you've heard me say I look sometimes at our court system. I want to make sure people look there and see justice that reflects, at least they see somebody who can understand where they came from. And you'll see that reflected in my appointments.
And finally, quickly, Governor, I hate to ask this like a couple times a week, but people keep asking me that they don't have symptoms. When should they get tested? Rank and file people in Connecticut, when should they start thinking about getting tested? Aside from all the CCSU kids today who were cheek by jowl outside the Capitol.
Yeah, they should all get tested. What do you think, Josh?
Yeah, no, our guidance has been consistent, and the governor laid this out earlier in the week as well, just as a reminder, but it's certainly anyone who has symptoms, any kind of even mild symptoms consistent with COVID, should absolutely get tested. Anyone who's had close contact with someone who's tested positive and is contacted through contact tracing or otherwise should absolutely get tested. And then beyond that, we're really focused on the populations that have the highest risk profile. People in congregate settings, nursing homes, assisted living facilities, prisons, and other, the staff associated with all those entities. And then also looking at, many of our densely populated urban areas that have been particularly hard hit by COVID. We're really encouraging them to come out and get tested in our big cities. And with that, we feel like from a public health perspective, we'll be well covered. We'll have a good insight into the disease progression across the state, making sure that the people who need the testing get it. Beyond that, it's less of a priority at this point.
Thank you.
Those on the call, please remember to mute your phones as our panelists answer questions. Please remember to mute your devices. Waterbury Republican American.
Thank you, Max. Governor, the summer school rules that you released yesterday, how likely are these summer school rules, what's the likelihood of them carrying over into the guidance for the fall? And can we look to the summer school rules as a sign of things to come?
I think it's the like spring baseball. We're starting out, as you know, with the summer camps because they're smaller and outside. Summer school, smaller groups. We can control that a little bit. Maybe graduate housing, as we've said before, all leading up to fall. That means K through 12 as well as college. And I think we'll be learning along the way how young people do when it comes to social distancing and occasionally having to wear that mask.
But is it sort of going to be a boilerplate, a template for continuing school when it reopens?
I'm finding with COVID, nothing's a boilerplate, Paul. I mean, I think we're learning all the time. But fortunately, we have some time this summer. And as you point out, we are going to have summer school. And I think Miguel is going to learn a lot. We'll learn a lot. Superintendents will learn a lot. They'll inform September.
Okay. And we got a couple of questions from some readers who apparently have been caught up in some of these highway protests. And the questions we're getting are basically, is there a statewide policy for handling protests, shutting down highways? And can you do anything as governor about it? I don't know exactly what they expect you to do, but...
Yeah, I'll start off and then Paul, help me out on this. I think our public safety folks, everything from our commissioner and the head of the state police and our municipal police chiefs, many of whom have been coming here over the course of the last week, I think they've handled it very well. There's some 90+% of all the protesters are there for the very right reasons, what they mean in terms of fighting for justice. There are some instigators who would love a confrontation, nothing more than a confrontation. And we're not giving them that. Our police chiefs are there. They're talking to the organizers, doing everything we can to lower the temperature. Obviously, being on I-84, one of these highways, is dumb and dangerous. And we're doing everything we can to bring people back. And I think we've done that pretty successfully so far. Again, we haven't had to arrest anybody, I think, for another night. But every day is a new day. Paul?
Yeah, to echo what the governor said, of course we don't want protesting on the highways, but I want to provide kudos to the Connecticut State Police and to the Department of Transportation, who've did an amazing job in terms of maintaining safety of not only the protesters but also those in their vehicles. With that said, one of the things that, and we said this at our earlier press conferences, many of these individuals are going on the highways during the day. We're really concerned if they go on the highways during the night, and that can be extremely dangerous. But we're going to continue to do what we do to maintain the safety of all those involved, and as the governor said, provide the necessary kudos when kudos is provided.
But you're not contemplating arresting people, mass arrests of mass demonstrators?
No.
And then I guess one final question, which I think goes to I think some of the points that Ken and some other folks were bringing up about the protests. We're getting readers asking, why aren't protesters required to stand 6 feet apart? Why aren't they required to wear masks?
Protesters are keeping us pretty busy, just getting them off of I-84 and getting them out of harm's way and doing everything we can to avoid big violence. If I can get them to stand 6 feet apart and always wear a mask, all the better. But to tell you the truth, Paul, I've been sort of impressed. I mean, most of the protesters I've seen have been wearing a mask. And I think it speaks a little bit to some of the higher values that they're trying to fight for.
Move along next. We'll move along next to the Day of New London. CT News Junkie.
Thanks, Max. My question is for Secretary McCaw. The federal government recommended that 45% of the grant, or about 630 million of the 1.4 billion, go to municipalities with populations under 500,000, which is every city and town in Connecticut. So I'm not understanding how you determined that 75 million for municipalities was sufficient.
Great, thank you very much for the question. And so you're probably aware that for municipalities or local governments where the population is greater than 500,000, that the feds were directly providing an allocation distribution directly to those entities. Obviously, Connecticut did not fall in that position given the populations of our towns. But what I would focus on with respect to the CRF is it has to be used for costs that are incurred. This is not a grant program where we can take 50% of the funds and look at your population and just distribute and send funds out. We actually have to have expenses that were paid and incurred for these legitimate expenses. And so for that reason, we thought it was most important to ask the municipalities, what are the costs that you are incurring? And so consistent with the intent of CRF, to direct cover the costs, right now our municipalities are making out with the best outcome, and that is what looks like an arrangement where they will 100% or close to 100% receive reimbursement for the expenses that have been incurred. That's feasible because of the anticipated ability to match the CRF against FEMA. And so when you look at all of the funds that are going to be available to municipalities, the 75 million that the governor's standing up that will leverage another 2 to 250 million in FEMA, our municipalities are looking at potentially well over $300 million of support depending on the types of costs that they've incurred. Last but not least, it's interesting, in some municipalities where they came in and the costs were really low, I spoke with some mayors and they said, well, the state's doing such a good job at directly covering the cost that we didn't have to directly take on the expense of decongregating our shelters or directly paying for testing. So I think what you're seeing here is what looks like a smaller allocation to municipalities because the state is directly bearing a lot of the expenses, and at the same time we're looking at our municipalities in the eye and saying, what you have incurred, we put together a program that appears that we'll be able to, by and large, cover the majority of your expenses. So I think we landed in a place where the feds ultimately were suggesting in terms of the support that states provide. And our briefings went exceptionally well. Not only were our Democratic leadership very pleased, our Republican leadership, and we know that public health crises are not really indicative of partisan politics. And so everyone was thoroughly happy with the outcome of what the governor is providing, along with our CCM and cost representatives. So we'll continue to monitor the costs that they're experiencing on the ground and the ability to leverage the federal resources, and we will evaluate the program if it is necessary.
So it is possible that they could receive a second round of funding here?
Well, remember, the first round is 40 million and the governor has allocated 75. So there's clearly a second round of at least another $35 million. But remember, don't look at the 75, look at the 75. It really is 25% matching another couple $100 million in FEMA. Our municipalities should have a couple $100 million in support. And if we find that the 75 million is inadequate, then the governor will evaluate whether or not he needs to make an adjustment. For now, based on our first look, we think this is a solid program to roll out.
And Christine, remember that the House has passed a big supplemental that includes direct funding go to the municipalities. This is, for the next year. And now it's sitting in front of the Senate. So hopefully Murphy and Blumenthal can move the ball there.
And Governor, are there any more plans for more testing in Bridgeport?
Absolutely. No, we rolled out the testing. We brought the mobile van there 3 or 4 times. Josh, you want to speak to that?
Yeah, no, absolutely. I mean, as I mentioned previously, one of the major focus areas is in densely populated or urban centers where we have a mix of dense population, low-income people who've been more likely to be essential worker out, and wanting to make sure we've got adequate testing there. So there's absolutely a focus on Bridgeport along with all of our other major cities.
Thank you.
Boceto Media. Connecticut Public Media.
Good
Good afternoon. We talked a lot today, or you did, about surviving 2020 financially. Since the stock market has rebounded, what effect will it have on tax revenue in 2021? How are you planning for next year?
Great. Thank you for the question. So obviously a portion of our income taxes are related to experience on the market, and I think the question ultimately would be the extent to which we can sustain what we've seen in the market. Right now, based on our last consensus revenue estimates, we had reflected about a 20 to 25% decline and in those tax lines that have some correlation to the market. Obviously, that's a bit of a guess. And when you look back at the last economic downturn, and certainly what we're currently seeing here does not look like 2008 and 2009 is not as significant, and we don't expect it to be as long in the time period. But that 25% was almost half of what we had experienced in the last downturn. So we obviously monitor this on a month-by-month basis. We will have a better sense in July on how we close fiscal year 2020, and our next consensus revenue update will be in November, and that's really when we're going to have a better handle on how we close fiscal 20, and it is our first look at fiscal 2021. So, our eye is on the needle. We'll have to continue to monitor, and let's all hope that what we've projected actually is pessimistic, and we see something a little bit more favorable, and that will help, and hopefully would help us with the deficit we have next year.
I guess that's the signal. Thank you, Melissa. You've been working pretty hard. Let me just say, we started off talking about trust. We got into this COVID crisis, and the first thing we did was reach to some of the best healthcare minds in the country and here in the state. Unfortunately, a lot of them were here in the state. Just as we tried to come up with protocols that allowed us to slowly mitigate the effects of the COVID crisis and make sure we limited the spread of the crisis, did okay, but more importantly, it was about trust, giving you confidence that what we were asking to do when it came to masks, when it's closing of restaurants, was based upon good science. And it's an art, not a science, but now as we slowly reopen, again, that's based upon trust. As I said before, also, that's for the consumer and the employee to make sure they slowly get confidence coming back. We talked a little bit about the state police, the municipal police, and the protesters. And they're two sides of the same coin. The police are there to keep you safe, and I hope you have some confidence they're doing that, and you take the safety issue as well as your right to express the reasons that you've been outraged over the last 10 days, something we listen to and understand. And Melissa is working hard, briefing the legislative leaders, trying to talk to you, because these are uncharted territories. As you see, our income has just disappeared over the last 3 or 4 months as we slowly build that back and what that means in terms of a budget. So that's why we keep doing these briefings, so you can hear our thinking as it evolves over time and give you a sense that we're trying to get this right every day. Thanks, everybody.